Welcome. Good afternoon. Good morning for some of you. My name is Corey Ranger. I use he, him pronouns. I'm the president of the Harm Reduction Nurses Association, and I'm very pleased today to welcome you all to an HRNA webinar, Entangled Perspectives, Unpacking Factors Shaping Community Views on Safe Consumption Sites. Now, before I hand things over to our presenter today, Tina, I want to make sure that I'm honoring the land that we may all be joining from. And so I would first like to personally acknowledge that I'm joining from the never ceded territory of the Cowichan tribe in what is colonially referred to as Duncan. And the Harm Reduction Nurses Association does work with individuals and organizations across all of Turtle Island and honor the life force of Indigenous people who have had their land stolen and who continue to resist ongoing genocide. Addressing the root causes of the toxic drug supply is deeply connected to decolonization. And much of what we get to do at the Harm Reduction Nurses Association, much of what we talk about and the education that we share has been made possible by people with lived and living experience of drug use, sharing their knowledge and expertise with folks like myself and Tina. So it's important to acknowledge without the generosity and the bravery of people with lived and living experience of criminalized drug use, vital life-saving harm reduction initiatives would simply not exist. If you're new here, the Harm Reduction Nurses Association is a Canadian national organization with a mission to advance harm reduction nursing through practice, education, research, and advocacy. It's never been a better time to join the Harm Reduction Nurses Association. We have all kinds of cool things like a course we run through the University of Victoria for nursing students. We put out position statements. We recently started a scholarship for nurses who work in harm reduction who want to advance their education further. So yeah, there's many reasons to consider joining, ranging from being a part of a national community of practice, being able to work on influencing policy through position statements and letters and other actions, and a number of our members have been able to participate in things like the recent best practice recommendations on harm reduction and wound care with the nurses specializing in wound and ostomy care. And so, yeah, my last plug here. Please do consider joining the Harm Reduction Nurses Association. We are at a time right now where harm reduction is under attack, and so we need our strength in solidarity. Enough of the sales pitch. I'm really pleased to introduce Tina Ranta today. Tina Ranta is a registered nurse who's led initiatives to expand access to care for people facing systemic inequities, homelessness, and stigma. Now, Tina is pursuing a PhD in nursing focused on safe consumption sites and community coexistence. We're so grateful to have Tina here today. And Tina, without further ado, I will hand it over to you and you can share your screen. Oh, we had it there for a second. There we go.
Thanks. Is it just on the PowerPoint without my talking
No,
notes?
it's on the speaker's notes as well.
Of course it is. Let's try that again. Murphy's Law.
It is important to note, folks, we did rehearse. So just in case you're wondering, sometimes best laid plans still go awry.
Me too. All right, let's try that again. I feel like we've been in the pandemic so long and Zoom so long, and it's still so nerve-wracking every time you go to start presenting. It never fails.
Feels like it's going to be the winner this time. Yep, you got it.
Is it good? Okay, wonderful. Thank you so much. Hi, everyone. So as Corey mentioned, my name is Tina Ranta. I've been a registered nurse for the past 15 years, and much of my work has been in harm reduction, mental health, and community health nursing. I hold a CNA certification in psychiatric and mental health nursing, and I am currently a doctoral candidate in the School of Nursing at York University in Toronto. My research focuses on how safe consumption sites are situated within their local neighborhoods, attending to the conditions and relationships that shape their coexistence. This question grew from my experience in managing and establishing harm reduction programming throughout my career, where community engagement was often met with resistance and stigma. I became not only interested in whether communities supported these sites or harm reduction programming overall, but how to create more supportive environments for people who use substances and programs themselves. To this work, I also bring personal experience. I was raised in environments where drug use was present, and I have lived experience with substance use myself. So these experiences have shaped my understanding of care and community long before I ever became a nurse and continue to inform how I practice and conduct research within this field. I want to thank the Harm Reduction Nurses Association for inviting me today, and thank you all for joining. So why is this important? So safe consumption sites continue to generate strong tensions in many communities that they exist in. There is substantial evidence that they save lives and improve health outcomes. However, outcomes alone do not explain how communities experience these sites every day. Research shows that public views are diverse and often divided, and the process through which those views are formed are not very well understood. My interest lies in how these sites are encountered through daily conditions, how interactions among people, environments, policies, and physical spaces shape coexistence as something lived rather than simply debated. Rather than trying to persuade or resolve disagreement, this work focuses on understanding how coexistence is negotiated within spaces. This approach can reveal where care already exists, where strain accumulates, and where small changes may support more sustainable relationships. I want to clarify that what this presentation is and is not. So the research itself has not begun. Today, I'm here sharing the background, purpose, and conceptual foundations that are shaping my work. I'm not presenting any findings or conclusions at this time. Instead, I hope to offer a way of thinking that invites reflection on the relationships, environments, and conditions that shape interactions, not only around safe consumption sites, but our everyday practice as nurses and other clinicians on the field here. This openness is intentional because the study is designed to remain responsive to what emerges in actual practice. To understand interactions around safe consumption sites, we first must situate them within broader structural conditions. Drug laws in Canada and elsewhere are rooted in colonial and racialized systems that determine which populations are surveyed, criminalized, or protected. Drug use has existed for millennia across cultures and is not bound to only the human species. The current framing of drug use as deviant is therefore historically constructed rather than inevitable. Canadian policy illustrates this clearly. So you may recognize this face that's on the screen on our $50 bill across Canada. This is William Lyon Mackenzie King. His investigation of the 1907 Vancouver race riot blamed Chinese immigrants for the opium trade and strongly influenced the development of the Opium Act of 1908. These racialized foundations continue to shape drug policy today by framing substance use as a moral and criminal issue associated with racialized and marginalized groups rather than a matter of public health. This orientation has supported punitive approaches, heightened surveillance, and regulatory limits on public spaces and how they're used, while limiting investment in evidence-informed care such as harm reduction. This pattern of history repeating itself is evident even in contemporary drug-making policy. A recent report from audits on safe consumption sites across Ontario was selectively used and distorted to justify changes to Bill 223, the Safer Streets and Communities Act and Stronger Communities Act, resulting in the closure of safe consumption sites across the province of Ontario. Safe consumption sites and all harm reduction programming operate within these inherited frameworks, which constrain what is considered acceptable or legitimate policy response to substance use. Within this context, the concept of necropolitics highlights how policy decisions determine whose lives are protected and whose lives are exposed to harm. A dynamic evident in recent site closures and punitive regulations that have contributed to preventable deaths and increased risk for people who use substances. Our drug policies continue to fail our communities. Community responses to safe consumption sites are shaped by perceptions of safety, responsibility, and belonging. These perceptions change over time as people encounter harm reduction programming or people who use substances directly or indirectly through media narratives, policy decisions, and local events. Public debate often reduces these dynamics to simple for or against positions, which obscures how relationships actually develop. Research shows that acceptance tends to increase when individuals have direct contact with people who use substances or witness overdoses, while opposition often intensifies when a site is proposed locally. In these cases, we often see heightened presentation of the not in my backyard phenomenon, also known as NIMBY. A gap in current research exists as there is limited attention to how relational and material conditions shape experience within these spaces. Spatial arrangements, daily routines, and repeated encounters influence how people interpret and how environments respond to safe consumption sites. Different groups such as staff, neighbors, businesses, and people who use substances may experience the same environment, but in very different ways. Most research focuses on outcomes or attitudes, leaving these interaction processes relatively unexplored. And this is where I would like to dig in my research. So this research is guided by curiosity rather than hypothesis testing. The central question is, how do safe consumption sites coexist with their local environments? I am interested in what shapes relationships beyond individual beliefs or ideology within these settings. Harm reduction occurs in specific places, shaped by physical design, social dynamics, policy context, and history. Understanding coexistence, therefore, requires attention to these layers and influences in order to address safety, care, and connection. So, critical posthumanism provides the theoretical lens for this work. It's a theory that challenges the assumption that humans are separate from or superior to the rest of the world. The image of Leonardo da Vinci's Vitruvian Man, pictured here, illustrates the historical ideal that still exists today in Western society of the human as a rational, male, white, able-bodied, universal, perfect human being. From a critical perspective, this ideal excludes many bodies and experiences while presenting one form of humanity as the standard. Instead, critical posthumanism asks which humans are centered and protected within social systems and which are marginalized, ignored, or treated as less than fully human. It also directs attention to non-human forces such as environments, infrastructures, technology, and even drugs themselves, recognizing that these elements actively shape everyday life. Rather than attributing social problems solely to individual behavior, critical posthumanism emphasizes relationships among bodies, spaces, objects, and systems. Outcomes are understood as emerging from complex networks of power, history, and material conditions. This framework helps us to question who is recognized as fully human and how do these assumptions shape responses to substance use. This perspective aligns closely with harm reduction principles because it begins with dignity and care rather than moral judgment. People who use substances are frequently portrayed as irresponsible, dangerous, or undeserving of support. These narratives are reinforced through policy, media discourse, and everyday interactions, continuing to contribute to stigma and marginalization. By shifting attention away from individual blame and moving towards conditions that shape risk, vulnerability, and survival, critical posthumanism offers a more comprehensive understanding of harm reduction environments. It does not replace the existing knowledge within our field, but helps expand it by making visible influences that often remain implicit, such as housing instability, policing practices, infrastructure, and even social exclusion. This broader view allows us to think differently about coexistence, not as a problem to solve, but an ongoing relational process shaped by multitudes of forces. The ethical grounding for this research comes from Rosie Braidotti's concept of affirmative ethics. Affirmative ethics values difference in coexistence rather than attempting to eliminate tension or force agreement. In complex social issues such as substance use, competing perspectives are inevitable and cannot always be reconciled. Instead of asking how to resolve conflict, this framework asks how people can continue to share space ethically despite disagreement. Care and responsibility are understood as relational practices that emerge through interaction and context rather than fixed or universal expectations. This orientation resonates strongly with harm reduction approaches, which prioritize dignity, respect, and non coercive care, even in the presence of ongoing tension. An ecological perspective also helps situate safe consumption sites within the broader environments that they operate. Sites are embedded in neighborhoods with particular histories, stories, economic conditions, spatial layouts, and social patterns that exist within them. These factors influence how people interpret and respond to the present of a safe consumption site, as well as people who use substances. Daily routines, patterns of movement, and physical design can all shape interactions in very subtle ways. Community responses rarely arise from a singular cause. Instead, they develop through the accumulation of many influences acting simultaneously. Thinking ecologically allows us to move beyond simplified explanations and towards a broader understanding of shared community space. So my research will focus on a single safe consumption site rather than multiple locations because of the complexity of the issue and the need for a thorough in-depth analysis. Examining several sites would require a broader approach that could overlook important local nuances, whereas concentrating on one site allows for more detailed understanding of the social, spatial, and community dynamics involved. The research will specifically examine an area within approximately a 3-block radius of the site, which is intended to capture the immediate zone where impacts are most directly experienced by residents, businesses, service providers, and people who use substances, while remaining manageable for precise data collection and analysis. By prioritizing depth over breadth, I aim to produce a comprehensive and context-rich account of what can be generated through meaningful insights for the community itself, and also to help inform community engagement and practices in similar settings for future. So I will be examining both human perspectives and more than human factors within the setting. So human perspectives include staff, neighboring residents, local businesses, people who use substances, even participants in community forums that are open to the public where meaning and opinions are constructed. At the same time, physical environments, objects, policies, and the characteristic of the drug supply itself also shape what happens within and around a site. Posthuman ethnography explores how these elements interact rather than treating them as separate domains. The research will use a post-qualitative design, meaning that methods remain flexible and responsive as the study unfolds. Knowledge is understood as emerging through interaction, and the researcher is actually considered a part of the environment being studied rather than an outside observer. This approach prioritizes attentiveness to context, relationships, and unexpected developments rather than following a fixed procedural plan that you see in general other forms of research. My research will also incorporate an arts-based component as a form of inquiry and analysis, recognizing creative practices as a way of producing insight rather than simply illustrating findings. This will involve collaborating with people who use substances at the safe consumption site to create a rag rug. Rag rugs are traditionally made from remnants and discarded textiles, demonstrating revitalization, resilience, and collective care, qualities that resonate strongly within harm reduction contexts. The process of making together is as important as the actual finished product. It creates a shared activity through which participants, materials, and environment all interact. This approach enables forms of expression that do not rely on verbal communication and acknowledge that understanding can be embodied, sensory, and relational. I personally chose the rag rug for cultural relevance to my Finnish heritage and history of weaving and textile work among generations of women in my family. Rugs are what we call rasumaktos, hold cultural traditions of collective creativity, practicality, and resourcefulness. And that is a picture of the last rag rug that I made as well too. So that's a real life photo. Perfect. So harm reduction nursing takes place in these complex environments. Practice requires continuous adaptation to changing conditions, relationships, and resource constraints. Nurses frequently perform roles beyond clinical care, which include mediation among community groups, education, research, advocacy. Nursing is post-disciplinary work. It often extends beyond traditional boundaries that integrate multiple forms of knowledge and experience and practice, especially in harm reduction settings where staffing is often limited and is not uncommon for the nurse to wear the hat of a social worker, pharmacist, therapist, and even beyond. Much of this relational labor remains invisible, yet it is essential to sustaining services and supporting both clients and communities. Viewing practice through this lens highlights how nurses continuously navigate interactions among people, policies, spaces, and systems in real time. Attending to these dynamics can inform more sustainable, ethical, and affirming approaches to community care. So, I guess, sort of just to conclude, I invite everybody on the call to reflect on the environments in which you work in. Doesn't necessarily need to be harm reduction, but to think about what routines, patterns, or conditions shape everyday interactions. What tends to be overlooked or taken for granted within these spaces? How do physical environments, organizational policies, social expectations influence possibilities for care? Within that, do you see certain spaces where tensions emerge or where care actually circulates? And where might there be new possibilities for development? So these questions extend beyond harm reduction because all professional practice occurs within relational environments shaped by structural and material conditions. I always like to try to end on a space of strength, especially when we're working through or speaking about difficult issues such as what's going on in our world today. So I invite folks to just take a moment to reflect on these questions. If you wish, make some notes for yourself or thoughts on your own observations, what comes to mind. And for those who are maybe feeling a little more comfortable, you're also welcome to share in the chat an example of ways maybe that care is situated within your context or expressed within your work environment. I don't know, Corey, if you're able to read some of the chat.
Yeah, I do. I am able to. And thank you, Tina, for that presentation. And as usual, when the presentation concludes and we get into the Q&A portion, we usually stop the recording so that if people are comfortable, they can unmute and go on video and chat with you. So I'm going to do that now.